So we recently talked about another non-opioid pain relief, but here comes another one. SBI-810 represents a groundbreaking advancement as a cutting-edge non-opioid painkiller that could transform how we treat chronic pain. This revolutionary drug offers hope for millions of patients seeking effective pain management without the dangerous side effects of traditional opioids. Chronic pain affects approximately one-third of Americans, creating an enormous burden on patients and the healthcare system. Meanwhile, the opioid crisis continues to claim over 80,000 lives annually in the United States. This devastating combination highlights the urgent need for a painkiller without the side effects that can provide effective non-opioid pain relief. And along comes SBI-810. What's happening here, John?
Yeah, so they developed this to target the neurostim receptor NTSR1. And what that is it's a protein expressed on sensory neurons and throughout the central nervous system, which includes the brain and spinal cord. So the thing with this receptor is that it plays a key role in modulating pain signals. So unlike opioids that kind of broadly activate multiple cellular pathways, this SBI-810, it uses a pharmacological technique called based agonism, which selectively activates this arrestin 2 signaling pathways or beta arrestin 2 signaling pathways. And the pathway is linked specifically to pain relief. So the cool thing about this is it does this without engaging other pathways that cause that opioid-related side effects, such as euphoria, tolerance, or addiction. So if this is cool, if this actually works, so they've done studies in mice, and it demonstrated effective pain relief. But if this actually works, this could be a game changer. And that's not written by AI. That's me saying game changer, which is really cool. What are your thoughts?
I love this idea. Anything we can get away from opioids and any of the stuff that really cause addiction, cause health problems, cause mental issues, when we can do something like this. Yeah. And all of those types of pain relief are designed to go down all pathways rather than just selective ones. So that leads to all these other side effects, and being able to understand that we can actually just target the pain pathway, and this will be non-addictive. It won't wreck your health in any way, won't affect you mentally. Then yeah, I'm really excited about this.
Yeah. So especially now that I learned way more about the opioid crisis, I watched that mini series on Netflix. Holy crap. So this is cool. And I know we've covered other pain relief kind of potential technologies, but this is great because of there really isn't an effective pain relief that doesn't give you the euphoria, that doesn't increase tolerance, that doesn't make you addicted currently, that's available in the market other than Tylenol and Advil and all that stuff. But there's nothing really effective for pain management. So if they can if this does actually solve that problem, then phenomenal, amazing, right?
Yeah, and it acts by suppressing the spinal neuron excitability. This action interrupts pain signal transmission at the spine level, preventing pain messages from reaching the brain where they would be perceived as discomfort and pain. The central action provides rapid, effective relief, but simultaneously it works in peripheral nervous system by lowering sodium channel activity. Sodium channels play a crucial role in transmitting electrical signals in nerve cells. By reducing their activity, the SBI-810 decreases the generation of pain signals at the source, providing comprehensive pain management from the site of injury or inflammation to the spinal cord.
It's still in early stages. They've secured multiple patents, and they're actually moving forward towards human trials. So if successful, this could be a game changer for pain management and provide some awesome, powerful alternatives for both acute and chronic pain. So I'm excited for this, for sure.
Yeah, in comparison, this innovative non-opiate pain relief option has shown superior results to ulcer a newer opioid medication in several pain scenarios, and even more impressive, has demonstrated better efficacy than gabapentin, a commonly prescribed anticonvulsant used for neuropathic pain management. So the tests so far have proven, it's pretty effective. So we don't know what the long-term effects of all this stuff is, but it looks interesting. And even says that it provided significant pain reduction for bone fracture in surgical incisions, simultaneous simulating post-operative pain. So interesting, like there's a lot of stuff here. And, we need to understand the safety profile and what that means. Ideally we wouldn't have the reduction in cognitive function, the depression, all
constipation, sedation, memory problems, apparently. So like all the benefits and none of the negative side effects, which is crazy to think of nowadays because of all of these drugs that are out there with all of these crazy side effects.
So we'd love to know what you think. Is this a huge step forward, or have we heard this before about non-opioid pain relief and it doesn't necessarily come to market? But they're talking about 3 to 5 years. When I was looking at this, so we should be seeing this stuff in trials and then in the market in 3 to 5 years. So love to see this and love to see how life-changing it'll be for some people we know. So what do you got going on, John?
Yeah.
July now.
I'm working on a webinar in August or September on shred and IP development or IP strategies. So watch out for that. Otherwise, I'm going to enjoy July. I know a lot of people are taking July off, but yeah. How about you, Craig?
Well, we won't be having a Startup Investor Drinks in July, but we should be having a Flowgrammer event and probably off the month of August. But if the group of Flowgrammer people want to have an August event, we'll do that as well. Other than that, I'm heads down. I'm working with clients now, building AI automations, and it's been fun and great. And right now, I know you're heads down working with clients on getting them funding.
Lots of programs. Well, not as many as before COVID, but still lots of programs. Exciting to see what opens up this year with the new liberal government in power. And so we'll have to see. Reach out to me on LinkedIn if you have any funding needs. But if you overall need some business help, how about where they find you, Craig?
Check out torontostarts.com for everything we do. It's all there. But we have a couple of branch websites, startupcoach.ca, where you can book some time with me. You can go to startupdrinks.to to find out our Startup Investor Drinks events, or flowgrammer.ca to find out all the information about business automation and how you can take your business to the next level utilizing AI and automation tools. And until next time,